Dr. Laro Charles, my name, I'm the Director General of Health Services, Minister of Health. This morning, I've been privileged to launch the Rapid Response Deployment Emergency Training Teams training, which is taking place in Mbarara. And this is the first training where we are having regional emergency medical teams trained. And this is for Mbarara region, Kabale, Masaka, and Potpoto region. So there are different people also representing the different pillars of the emergency medical system which are being trained here. All of you know that Uganda is prone to outbreaks. We just had an outbreak which was declared on the 31st of January this year, which took us almost 85 days to control. We had another outbreak in Kasanda and Mubende in 2022. Then we had COVID. So in the last 20 years, Uganda has over 8 Ebola outbreaks. But also there are outbreaks of the measles, there are outbreaks of cholera. So it means that we are trained. And the reason why we have organized this training is that we want to build capacity of teams which are ready to be deployed within 24 hours. And then the teams from the center will only support them. So the deployment within 24 hours is able to first bring the outbreak to control within the shortest time, and then mitigate the unwanted effects, like the poor outcome or the number of deaths, leave alone the economic effect which outbreaks have. But we emphasize that even as we respond to the outbreaks, we have to see that we maintain services, the essential healthcare services, because we do not want mothers and children or other people dying because of other conditions other than the outbreak. So we think that when we have these teams, we will have built a very resilient teams who are in the region, and they are well trained. They can be able to respond and be able to bring the outbreaks to control. That's the purpose why we are here. So we're working with the different partners, WHO, IDI, Baylor, and as a ministry, we think that we should have all this. So we already have teams at the district. We already have teams at national level. So what has been missing, we have not been having teams at regional level. So now when we have this, then it will be complete. You will have teams at the national level, you have teams at the regional level, and you have teams at the district level, which can be able to contain any outbreak or an outbreak threat which breaks out in this country.
This thing is going to be around for a whole day. First
Ate Kajirita, Nyakura emergency operations at Ministry of Health, Kampala. So ninkura operations za emergency kuko bora okudi chimone bwaho state veganisi. So ngumurimo yanje. So jesha turi mbarara training a team ndijo nsya eraberia region abene basing region. So twara abantu kurugambara Kabare, Fort Potro, Masaka. So ezo teams zinaba kubinji batakwatine ba nurse, ba doctors, ba dokora benyamishwa, multidisciplinary team. So chitukwendera team ezo noja muskwatanize zibuchachiri in the local communities by quickly baba chicho but solving tarindiriza Kampala tunubwire bwinyi nogira ngo ikizibu cyagwisingiro bino kurinda Kampala barinde Kampala barinde timerge Kampala barinde Kampala yashikire ushanga ngo umuntu wantunga motaka yamba isingiro umuntu no wa hiha district ndijo wisingiro takayambara kaimwe yate bibiri so ushanga ibintu bitakutambura so tugira ngo ati twata team regional level immediately sinjo yafune kizuru regional yirukaneze sinjo cyetaga shahira kikwetaga shamukaga ninga nakuzinga yokuza kuruka Kampala. So that is the reason for this team. so neza kuyamba munonga ikwataganse n'aba district immediately preparing kandi responding to public case emergencies mbwira kucyo munonga 24 for the 8 hours no kwangu immediately bakoze response yetu. So njo yonshonga nkoyo kora turiya jangu twena twatanise n'aba community n'aba district hatu region then jaza kwetaga Kampala ruyere cyo kiri cyangwa turengwa hatu sinu kusindika tani timu yerge Kampala turengwa mpango kandi banetazi.
Athaire ninkorana n'ekitongole kikorre by'amagara mu Tiona and attached to Uganda country office, and my role at the Rachel, I'm the country emergency readiness officer. Ningashini nyambaho omukweteekateekera oburwaire obwo bukuba nibubarakaho omu byaro ningashi omu bantu obwo abantu abingi bakuba batatebeekanisiize. So twisha tukwatanise na Ministry of Health okureba ngu twatraininga region zina twaba traininga abo kuba already they are trained konka twayongera okubabangura omu in the skills ezo kugira ngu habaho oburwaire obwabo mu kyaro biruka bayirukirira abantu kandi batategereza ibyaba Kampala. So ekyekyo nikituyambaho hano orebana na empehezi insurance chendero mbafanda zabatwire nabeisha. So baba riyo mu region kandi baka responding very fast, so it is more cost effective and it is more efficient. First of all bakiraho mbwire neberukirira abantu mbwire kandi n'abantu babasa gukora ekyo bakubera nibategereza kugira ngo abakampara bisha bakore. Secyo turi aho gukora workshop yatandukanye izoba neje kutware enake 5 okutya Friday